Hello friends, welcome to the Healthcare Today. Today what I am going to talk about is the difference between a gynecologist and a reconstructive and cosmetic gynecologist. All of you by now know the difference between a physician and a cardiologist. So if you have a heart attack, you don't go to a physician, you go to a cardiologist if you need the standard of care. Even if you go to a physician or you go to any practitioner of any system of medicine with a heart attack, no one is going to refuse to treat you. They will try to do whatever best they can within the limitations of the skill and knowledge they have acquired over their training and education. So they will not refuse you, but they may not be able to treat you like a skilled cardiologist and save your life. So similarly, there is a difference between a gynecologist and a reconstructive and cosmetic gynecologist. So who is a gynecologist? Gynecologist is a journalist gynecologist who would take care of the female health issues, the health issues which a woman undergoes like childbirth, delivery, pregnancy, then maybe if she is not able to conceive, trying to help her conceive and then probably refer her to a subspecialties into the IVF practice, or try to diagnose a cancer of the female genitalia and then refer her to a gynecological oncologist who will be a subspecialist. So this is what a gynecologist is. Probably the first person whom a woman reaches to if she has got a problem. Now, what is the difference between the gynecologist and reconstructive and cosmetic gynecologist? Exactly what I explained to you, the difference between a physician and a cardiologist is the difference between a gynecologist and a reconstructive and cosmetic gynecologist. So if you have got any issues related to your urinary issues, let's say for example you have got urinary incontinence, when you leak urine, when you cough, sneeze, laugh, running during intercourse, or if you feel that your vagina has become loose, lax, and there is something coming down from the vagina, it may or may not come out actually, but you feel that there is something coming out, you feel that you are not able to enjoy your marital bliss the way you were earlier before you had childbirth, or you feel that there is intense itching in vagina which is not being treated by your treatment and requires again and again some kind of treatment, or you feel there is pain during intercourse, you are not able to enjoy your sexual life. Now if you go to a gynecologist is not going to say no, I won't treat it. She or he would treat it, but then the quality of care or the skill and expertise required to treat it to a higher standard probably may not be available with every gynecologist. So for this requirement you need to go to a reconstructive and cosmetic gynecologist who has attained some kind of additional skill enhancement, additional knowledge, additional training and additional certification into reconstructive and cosmetic gynecology so as to provide you the standard of care. Now what does this entail? What all is acquired by these reconstructive and cosmetic gynecologists to give you better care? They are given expertise into the reconstructive and cosmetic surgeries which are probably requiring the highest level of skill what you require in any surgical specialty. Then these people are trained on various energy based devices like the lasers, the radio frequency devices, the plasma energy devices, the magnetotherapy devices, the functional magnetic stimulation, the high intensity functional electromagnetic stimulation, so on and so forth. And they are taught the differences when you have to use which device to treat what patient. They are precisely told the difference between the surgical modalities and the non-surgical modalities and how to customize the treatments for these problems which are very complex issues. This is what a reconstructive and cosmetic gynecologist has acquired during the additional skill enhancement, training, certification and qualifications which they get over and above the base of a general gynecologist. So if you have any of these issues, you must go and consult a reconstructive and cosmetic gynecologist and not a journalist gynecologist. Let's say you finished your pregnancy. Fair enough, you became pregnant, you delivered, you had a normal delivery, a vaginal delivery or a cesarean section. This is over. The role of gynecologist becomes over at this point of time. Now comes the role of a reconstructive and cosmetic gynecologist to give you back a pelvic floor rehabilitation program so that you feel the same confidence in your pelvis what you used to feel before pregnancy. No laxity, no looseness, no urinary problems, no itching, no burning, and you enjoy the same feminine and sexual life what you were enjoying before. Now this is what a reconstructive and cosmetic gynecologist only, and that too who is fully equipped with the equipment and paraphernalia required to deliver this will be able to give it to you. Let's say you feel vaginal laxity, you feel that the vagina has become loose and you are not able to enjoy your sexual life, your marital bliss the way you were doing it before childbirth or 10 years before. Now what do you need? If you go to a gynecologist and say tighten my vagina, no one is going to say no to you. But then if she or he is not a reconstructive and cosmetic gynecologist, the exact skills required to give you a precise vaginal tightening the way you want it and without any painful intercourse or dyspareunia as they say can be given to you only by a skillfully trained reconstructive and cosmetic gynecologist. If you have pain during intercourse, if you are not able to have sex, if you have dyspareunia, if you are not able to consummate your marriage, now who will be able to help you? Probably if you go to any those roadside doctors also who claim to be the sexual therapist, they may also say we can help you. If you go to a physician, you go to a gynecologist, they will say yes, we will try to help you, and in all earnest they will try to help you, but because they are not equipped with the requisite skill and knowledge to give you advanced help, so they may not be able to give you what you need. So these are the situations where you have to visit a reconstructive and cosmetic gynecologist. Now you want to get treatment for a urinary incontinence or a vaginal laxity and you don't want to undergo surgery. Now probably unless and until someone is trained in reconstructive and cosmetic gynecology, he or she cannot differentiate that would you be able to get helped by non-surgical modalities using a combination of energy-based devices and electromagnetic therapies, or would you need surgery? Now this needs a very skilled reconstructive and cosmetic gynecologist to differentiate and precisely give you an individualized treatment, because all the issues which I have discussed with you, they do not need a standard treatment. It is not a one size fits all treatment which can help you in these cases. It has to be a customized, individualized treatment, a full treatment plan which has to be made for you so as to deliver you what you want, and this can only be done by a reconstructive and cosmetic gynecologist. We care about you.